program was designed to address obstetric and neonatal emergencies that happen in rural hospitals, small community hospitals. Moms and babies are very vulnerable. There's a lot of mortality. There's a lot of comorbidities with babies being born. What this program is trying to do is get those smaller hospitals who don't have any training and don't have the services to manage small babies or even mothers, give them the tools, the education, the hands-on training, and the equipment to actually take care of those small patients, to recognize some of the symptoms of very serious conditions, recognize those symptoms, and be able to stabilize those patients so that those patients can be either, transported to a higher level of care or managed there in their ER. Most of the time they're going to be transferred to a higher level of care because in an emergency situation there's other things going on. So our job is not to make experts, OB or neonatal experts out of these ER staff. Our job is to give them the tools and the training that they need to manage those emergencies until they can get help. So the STORK training is a 4-hour training, and it starts with lecture, PowerPoint, a lot of conversation with Dr. Morris, who talks about OB emergencies, what an OB patient is and how it's very, very different from a regular patient. She goes through a lot of emergency situations like emergency delivery, obstetric hemorrhage, preeclampsia, those kinds of things. Talk a lot about that in 2 hours at the beginning of the course. Then the course changes and it becomes a hands-on training simulation course. So the people that have gone through the lecture, they then come into the training room and they learn hands-on how to manage all those things that they just learned about. We have lifelike simulation mannequins. They are the ones that they have vital signs, they talk, they give you information just like a regular patient would in the emergency room, and the students learn to manage those emergencies. They have to figure out what it is, they have to diagnose it, and they have to treat it and manage it until, to basically to help keep that mother, keep that baby alive. So we've got an obstetric mannequin. We also have a neonatal mannequin. So we've got one group that's taking care of the mother, one group that's taking care of the baby. Because now when you have a pregnant mom, you actually have 2 patients. So you've got to double up on your knowledge and your team.